Qualified, professional, and compassionate doctors talking real solutions to real health problems.
It's always a joy and an honor to be with you every Thursday evening. We don't take it for granted that you take off time to join us in the discussion about your health, because your health is your wealth. That's why at the Doctalk show, we made a pledge to you to always look out for every issue to do with your health. And when we get it, we come and do share with you and invite you to join the discussion. And tonight, it's a very important topic of discussion. In studio with me, a very important guest that I will be introducing shortly. And before I do that, I would love to make special mention of our sponsors, the National Medical Stores, the government body responsible for distributing drugs and medical sundries across the various public hospitals and health facilities across the country, as well as Camelin Men's Collection. Did you know that 1 out of every 3 Ugandans is an adolescent? Yeah, let it sink in. Every time you count through people, the third person is an adolescent. And you may be wondering who an adolescent is. Well, our guest tonight will be telling us more about that. And our guest is none other than Dr. Sabrina Chitaka. She's a wife, a mother, a pediatrician, and adolescent health specialist, as well as a senior lecturer in the pediatrics department at Makerere University Medical School. She's also an author. Oh, the list is long. Dr. Sabrina, welcome to the show this evening.
Thank you very much, Dr. Gavin. Good evening, viewers.
Wow, what a profile. How do you juggle all these things? And I was still reading.
Thank you very much. I guess people have to read my little book, which I wrote.
Okay.
It's called The Real Pursuit of Excellence.
Wow.
And the Art of Multitasking.
Oh, so
Yes.
actually address that question
Yes.
in the book.
Mm-hmm.
Say the book again, the title of the book?
The Real Pursuit of Excellence.
The Real Pursuit of Excellence.
Mm-hmm.
Where can people find this book?
The book is available in Aristoc, but I guess the easiest way to find it is call me. I'll deliver the book to you.
Wow, how much does it go for?
It's now 35,000 Ugandan shillings.
Wow.
Yes.
That's a book you don't want to miss in your library. I guess even it's a family book, it's understandable, children can read.
I've been able to sell 1,100 copies since I published it in July last year.
Okay.
And for me, that's a big achievement. And
Wow.
I want to thank every single person who has bought a copy of The Real Pursuit of Excellence.
Wow. We will be sharing Dr. Sabrina's number so that you make your order of the book. Yeah, but tonight, like I said, 1 out of every 3 Ugandans is an adolescent. And Dr. Sabrina, our viewers could be wondering, who is an adolescent? We don't want to take it for granted that everybody actually knows who an adolescent is.
True. So an adolescent is a human being aged between 10 and 19 years. There are many versions of who is an adolescent. They are also called teenagers. In our local language, betuita abavubuka. But generally speaking, an adolescent is anyone aged 10 to 19 years. And these people are going through a transition period. They are not children and they are not adults. And they are going through so many changes. So we call it a transition period.
A transition period. Some, if they're not given attention, some actually may stay children.
Yes.
May keep on the side of children, or others may go to the adult side
very
so fast.
quickly and have challenges as they
relate
as adults, yet they are not yet adults.
And so it's a very significant season of somebody's life.
True.
Yeah, and so why should we be interested in adolescent health?
So I'll tell you, like you correctly said, adolescents are ubiquitous. There are so many in the whole world, we think that 1 out of every 5 people is an adolescent. That means that approximately 1.2 billion people in the world are adolescents.
Wow.
In Uganda, because we have a young population, nearly 1 out of every 3 people is an adolescent. And that means we need to care for these individuals. We know that the health system really caters more for little babies below the age of 1. We also care a lot about children below the age of 5. And when these people become 10 years of age, people tend to ignore them and they fall through the cracks of our healthcare system.
Yeah.
If you went to a hospital like Mulago, for instance, some beds may not fit the adolescent if they became ill.
Wow.
Like, for example, if an adolescent comes in and they have malaria and they are really tall, you would wonder, where should I take them? Should I take them to the adult clinic or should I take them to the children's clinic? And these adolescents have a lot of challenges. First of all, because they are rapidly changing, their physical stature is changing, they are growing taller, they are developing secondary sexual characteristics like breasts for girls. The boys are developing beards and even they are becoming more muscular. But
their voices are cracking.
Exactly. I keep telling my son like a broken record, but and also their emotions are in turmoil.
Oh yeah.
Today they are happy, tomorrow they are sad, they are concerned, they are worried. And so they get through a lot of challenges even as they grow up. And so if we as healthcare providers do not understand how to take care of this population, we may lose a generation.
Wow.
We usually say that adolescents fall through the cracks of our healthcare system because if an adolescent becomes ill, they don't quickly know where to go. And that is why the WHO in 2016 released a policy brief and said every single healthcare provider should learn a little bit about adolescent health.
Wow.
So that even if you're a surgeon or an obstetrician or a psychiatrist, it's important for us to know how to take care of these adolescents.
Yeah. And when you mentioned that, actually, I remember because I graduated in 2009, but I never actually interacted with adolescents when I was rotating in pediatrics, maybe because I missed some of the lectures. But
surely, Dr. Gavin, you must have seen a 10-year-old child.
Yeah, but
maybe
I'm saying
one who came in with tetanus.
Yeah,
or...
Well, I saw them, but they were not so much given emphasis.
Exactly.
Probably it's something that is coming to the light right now.
Incidentally, I've been teaching adolescent health at Makerere University since 2002.
Wow.
So I hope that some people did not.
No, but I'm glad that it's being given a lot more attention today than it was 10 years ago. And I believe even for the health workers that are watching us tonight, it is something that we're going to give more attention as these people come to our facilities. I know you've mentioned in a period of transition, neither young nor adult. What challenges, individual challenges, do these people face?
So, like I said, most of the adolescents are healthy people.
Yeah.
But they face a lot of emotional challenges. So it's during adolescence that people may develop anxiety, neurosis, they may develop panic attacks, they may develop suicidal ideation. I have seen adolescents wanting to harm themselves.
Oh dear.
It's serious. And also we know that it's during adolescence that people become inquisitive in the area of sexual activity.
Oh, yeah.
And some adolescents have actually fallen pregnant during that period. We know very much that it is during adolescence that people start using drugs of abuse, cigarette smoking, alcohol. And so it's important for us to cater for their needs, but also to guide them to make the right choices.
Wow. And a very important statement you made is that 1 out of 3 of Ugandans is a very big population. And if we don't give them the necessary attention, we are going to lose a whole generation. So this is a call, not just for the medical workers, but for every Ugandan watching us tonight. that we need to give special attention. We are going to take a short break and we'll be coming back, and Dr. Sabrina will pick it up from where we stopped. Kindly share the link with your friends and family members. Doctalk Show, that's on Facebook as well as on YouTube. Leave your questions in the comment section below. Thank you very much. We'll be back in a moment.
The Doctalk Show. The Doctalk Show.
You're really doing a very fantastic job keeping it here with us, and thank you for sharing that link of our YouTube as well as Facebook channel, Doctalk Show, with all your friends and families. Special thanks to our sponsors, the National Medical Stores and Camelin Men's Collection. This particular group of people between 10 and 19. So do we have service? Are there health services? Are there places that these people can go to in Uganda today?
Well, I'll say that they are there, but they are very few and not easily accessible. And so my call to action, if it were, would be that every single healthcare provider would be trained in adolescent health provision so that they become more adolescent health responsive. Of course, we know that there are older adolescent health services like the Naguru Teenage Center.
Okay.
Then there's Richer Hand Uganda. There's Reproductive Health Uganda. But also in Mulago, we started an adolescent health clinic every Friday, which runs from 8 in the morning up to 1 p.m. And in October last year, I started an adolescent health facility in a private unit at the IMC Kololo every Wednesday. And you'd be surprised. Parents are bringing their adolescents for care, for vaccination, for support, for career guidance. And most importantly, they are bringing the adolescents to speak to someone who is independent.
Wow. That was in October when you opened the private practice?
Yes, at the IMC Kololo. And to date, I think we've seen more than 50 individual clients.
Wow.
Which is amazing.
The need
is
so
big.
The
need is so big, especially in the private practice.
Wow.
Because remember, in the private practice, it's more easily accessible. And I think that parents are more comfortable going to a private practice sometimes than the general clinics.
Oh, yeah.
Yeah. And so we need to cater for that population as well. We know that adolescents come from different backgrounds. There are those who are extremely poor. There are those who are extremely vulnerable, like the street children. Those need help as well. But there are also those adolescents who are locked up in tall fences, who will not tell anybody. They'll try to seek their own solutions. And some of them end up harming themselves. And so, or seeking advice from wrong spaces. So we need to be extremely careful and supportive. I know that adolescent health cannot be resolved by just the health care providers.
Wow.
So we work with community volunteers. We also work with the school system.
Wow.
A lot of adolescents are actually in school.
The biggest portion of the year.
It's so important for schools to appreciate that, one, they need a counselor. The school health policy needs to be realized and materialized so that when adolescents are at school, they are also catered for.
That's right. The teachers have got to be empowered, not just to be there passing on the knowledge from the textbooks, but also to look at the adolescents in whole, not just people in totality. Yes.
Because as an adolescent is growing up, a 12-year-old will not have the same exact challenges as an 18-year-old. The 12-year-old may be anxious about changing school, anxious about starting her period. The 14-year-old adolescent may experience wet dreams for the very first time, and they will be confused. So if a teacher does not know how to handle such a situation, the adolescent may become depressed, lose capacity to concentrate in class, and then maybe stop eating. And we know that adolescents suffer from nutrition problems as well. Some of them refuse to eat the school food, and they end up not growing adequately or appropriately. Yet this is the time when they need to eat A healthy and balanced diet.
Which is very important for to boost their brain maturity, so that they're able to concentrate in class at that time.
And then we know that adolescents may also have sleep challenges. Some adolescents don't sleep enough, and that will affect them, their ability to concentrate, their ability to reason, but also for their brains to grow. You know that it's during adolescence that the gray matter in the brain grows for the very last time.
Wow.
And we cannot talk about adolescents without talking about young people. And young people are those aged between 10 and 24 years.
Okay.
And it is during that age bracket of being a young person that your creativity is at its maximum. So if you're there and you're 25 and you've not been creative in any way, then sadly, you've lost the opportunity to ever be creative.
That's so true. All, whatever field it is in the world where we have champions, the peak, like Dr. Sabrina said, of their creativity was between the age of 10 and 24.
Yeah.
Talk about the Tiger Woods of this world, talk about the Serena Williams of this world, talk about the Mark Zuckerberg, the famous guy for Facebook, and all these guys. If you go and read about them, the time when they began developing these ideas was between the age of 10 and 24. So we could be missing out on the next world billionaire, like Zuckerberg from Uganda, or from Africa. So this is a very important topic tonight. Dr. Sabrina, from your practice, one of the things that is so popular nowadays everywhere is the social media. Is there an impact that social media has on adolescent health?
Very, very much. Now, social media interaction is living in the internet age, really. And we know that millennials, people who are born in 1990 onwards, I'm not sure if you're a millennial.
No, I'm not.
Okay. So people who are born from 1990 to onwards are called millennials.
Yes.
And this is the time where the internet age became prominent. Now, millennials are instantaneous. They want things to happen in an instant. So they will post a picture, and if people like it, then they forget about it in the next a few minutes. We also know that there's a lot of social media apps coming up. Snapchat, Instagram, Facebook, Twitter, TikTok. Some people have said they are not going to go to school. They want to be TikTok experts.
Can you imagine?
Like, what's your dream and aspiration? I want to be a TikTok dancer. And that's a challenge. They want to be media influencers. But we need to push our children and adolescents in general to reach their fullest capacity, to complete their education cycle. Because if adolescents do not complete their education cycle, then they are going to start doing adult things, getting children, wanting to work, and yet they are still children. And there will be challenges like that.
Exactly.
So completing the education cycle is actually protective. So I think that social media has its benefits and it has its risks.
That's right.
We know people who have been kidnapped just because they friended a person who is
on social
a
media.
pedophile, a kidnapper.
Oh yeah.
And also people spend a lot of time on social media. And so they develop complications of backache, eye problems. They also develop challenges of a thumb, the thumb pain, which is a neuromuscular problem.
Because they were on the phone.
They are tapping their phone, tapping away, and they end up not doing anything. We know that people who spend hours on end on social media, not doing any other thing but just social media, they will end up gaining excessive weight, but also not being healthy. So their cardio is not functional. They need to get up and play and appreciate the sunshine, but also sleep. Children and adolescents are spending a lot of time on social media and missing out on sleep.
Which is a very important aspect of one's health.
True.
Minimum recommended, is it 8 hours?
We usually say minimum 8 hours, but I don't know if there are many school adolescents who sleep for 8 hours in this country, which is a problem.
Which is a big problem.
Yeah.
And not just actually, yeah, you talked about the age of 10. My son, who is 11 years old, is having trouble. There's just so much work. Even if you try to tell them to sleep, there is just too much work. So thank you for addressing this issue, and I hope the school administrators are listening in. Sometimes there's too much work. Of course, like Dr. Sabrina said, sometimes they end up taking off time to do a lot of social media, and they end up not getting enough sleep. Yet sleep is a very important ingredient of good health. We are going to take a short break, and we'll be back in a moment. Please share our link, Doctalk Show, on Facebook and YouTube. We'll be back in a minute.
The Doctalk Show. The Doctalk Show.
You're doing a very wonderful job keeping it here with us and for sharing our link. And to our sponsors, National Medical Stores, the government body responsible for distributing drugs and all the medical sundries across the country to public health facilities, as well as Camelin Men's Collection, located at the Zebra Plaza, for bringing this show to us every Thursday evening. We can't thank you enough. And those that are just joining us now, Dr. Joseph Gabin Nyanzi, your host, with a very wonderful guest this evening, Dr. Sabrina Chitaka, and we are discussing something very important to do with the adolescents. We've discovered that actually 1 out of 3, you count 3 people, every time you get to number 3, that is an adolescent. That's a very big population. And basically our nation, the future of our nation, 50 years down the road will depend on these people, so they need the attention that they can get today. Yes, Dr. Sabrina, from your experience and practice, what are the common problems, health challenges that the adolescents present with when they come to hospital? That is, if they come.
When they come. So I'll tell you, and I'm going to look at data from our Friday Adolescent Clinic, which we opened in 2013, and we have since seen over 7,000 individual clients.
Wow.
That's a lot.
Quite a number.
The truth is, many adolescents are healthy. They just come in for information. But there are those who come in with real challenges, nutrition problems. I have seen adolescents who present with anorexia nervosa, like a total disregard and lack of a relationship with food. And they end up losing weight, their hormones become deranged, and
that's an eating disorder.
It's an eating disorder.
They don't want to eat food at all.
They don't want to eat food. And some adolescents present with depression, with suicidal ideation, and some just come in for vaccinations.
Okay.
But whichever adolescent comes in, and we do know that also at Baylor, Uganda, we run the general HIV Adolescent Clinic every Tuesday.
Okay.
So we do have quite a number of adolescents who we take care of at the Baylor Clinic with HIV. Those who are born with HIV, but also those who acquired HIV along the way.
Along the way. Wow.
So we've received adolescents who are abusing drugs. We once received an adolescent who was a street child and he wanted to reform. Some adolescents come in because they have a sexually transmitted infection, and you obviously know how that happens because they are sexually active. The youngest adolescent I have managed was a 10-year-old who presented with 2 sexually transmitted infections.
Wow. 10-year-old?
10-year-old.
That is serious.
She came from a rather difficult family background, but we were able to support her.
Okay.
We've had adolescents coming in and they want to procure an abortion, for example. And we've worked with a social worker. My colleague, Dr. Joseph Rujumba, has worked a lot with us to support these adolescents who may have social challenges.
Okay.
When we see these adolescents, we don't work alone. We refer them to a psychiatrist if they need help from a psychiatrist. We refer them to an obstetrician or a gynecologist if they do need help like that. But we've also faced adolescents who just have anger management problems. And those anger management problems are arising from family disgruntlement. parents are separating, parents are divorcing, and then the child responds by being angry with life. We've treated adolescents who have been bullied at school, and school bullying is a real problem. The bullying may be subtle or overt, and it's a real problem. The child may present with refusing to go to school, may even become delinquent and want to escape from home. We've addressed challenges of adolescents who have sports injuries.
Okay, wow.
So it's everything and everything in between that we will receive. But our job as adolescent health providers is really to coordinate and identify the risk all the time.
Oh, okay.
Some adolescents have minimal risk, and those we support to continue on that path.
Wow.
But some adolescents have real risks. Real risks like sexual molestation, they've been sexually abused. Other adolescents are pregnant and wanting to commit suicide. Other adolescents just have mental illness.
Okay.
And those need to be referred urgently to a psychiatrist.
In case of sexual molestation, do you involve the police?
Oh, yes. We do involve the police, and there are criteria. We have to complete the police form 5,
Okay.
which is so important, to understand the extent of abuse, report to the police, and be the expert witness.
Wow.
But as you know, our justice, law, and order management system is clogged to the core with a lot of defilement cases. And if there are any cases that are not being prosecuted, it is the defilement cases.
Yeah.
Which is a challenge, because subsequently it is the adolescent who suffers.
Yeah. You also mentioned about bullying. Do you have adolescents who are developing psychological problems because of corporal punishment at school?
Certainly, yes. And we have seen, because corporal punishment is outlawed in this
Uganda,
country.
yes.
But the irony is, teachers continue to corporately punish children.
Oh my God.
We've seen adolescents and even younger children come in when they've been injured. And we call that a non-accidental injury. And non-accidental injury is actually punishable. So perhaps this is the time where we reach out to the teachers and ask, if you're so angry and you want to punish by beating an adolescent, could you step back and come back and just talk to them? You don't have to cane them. Caning has never solved problems.
I don't even know what to say. I cringe at the thought that actually that is something that is still happening in our schools, in spite of the publicity against corporal punishments. But actually, from our guest tonight, adolescents who are school going are still facing this challenge. I hope for the head teachers that are watching us and policymakers in school, something can be done about this.
And
I've heard of one actually who was refusing to go to school
because the teacher bullied them.
Because the teacher actually caned the whole class, and now he was really afraid of going back to school.
And sometimes it's not even that particular adolescent who has committed the crime or broken the law.
Yeah.
But I feel that these teachers are trying to exert physical power and show that they can beat up somebody. The moment you start beating up somebody or yelling at someone, it means you have failed to communicate.
Wow.
We should be promoting positive reinforcement, motivating these young people, and encouraging them to be respectful. It is not respectful to pick up a stick and start beating aimlessly. I know that some people will say, if there's a proverb, you spare the rod and spoil the child. That has to be taken with a tinge of salt, because spare the rod and spoil the child can also mean that this particular individual who is corporately punishing people may have a psychological problem themselves.
That's right.
That they are exerting their failure to manage their own anger and temperament by physically beating people.
Wow. This is a serious challenge, but I hope as we talk tonight, those that are concerned, of course, the parents out there, please, when your daughter or son comes back home and they're complaining about being caned at school, it's something to seriously take up because it's affecting their progress academically, affecting their progress relating with other people. We are going to take a short break and I will be coming back for our last segment. Please leave your questions and comments in the comment section below on our Facebook and YouTube channels, The Doctalk Show. Thank you so much to our sponsors, National Medical Stores and Camelin Men's Collection.
The Doctalk Show. The Doctalk Show.
Thank you for keeping it here with us as we come to a close of the show. In this last segment, those that are joining us now, it is discussing adolescent health tonight. That's what we are handling. And we could get no better person to give justice to that topic other than Dr. Sabrina Chitaka. Dr. Sabrina, wow, 7,000, that's quite a number. You really made a big contribution to the nation.
Thank you.
Yeah, so for these 7,000, do they walk to your clinic alone or are they brought in by parents? How do they come to the clinic?
Interesting question. So most of the adolescents actually come with their parents, and we want to thank the parents who bring these adolescents to us.
Wow.
But also some adolescents come on their own because they've heard from their friends that there's an adolescent clinic, and they come in for information, they come in for their school examination, you know, the medical form that is requested of schools.
Oh, they come back.
So they just come and get their exam done.
Do you charge them?
No, it's free. At Mulago, it's free. But at the private practice, it's not free.
It's not free. Okay.
People have to pay because it's private. And I'll tell you that when adolescents come in, they come in with their parent. We obviously appreciate the parent coming, but at one point we'll ask the parent to respectfully step out of the room so that the adolescent can talk to us privately. What the promise we have to this adolescent is that we shall keep their information confidential. And the only time that we shall break confidentiality is if they are going to harm themselves or they are going to harm other people.
Other people, wow.
That is already from the beginning of our, our interview.
Oh, okay, you make it clear.
We make it clear to them.
Wow.
And I truly appreciate the adolescents who have come because I've followed up adolescents from when they were 10, 2013, and then 2020, they are 19, and they join the university.
Amazing.
And they come back to sign out. For me, that gives me great joy to see that this adolescent has grown from S1 and now joining university, and they've made the right choices.
Amazing.
We usually ask them about their hopes and dreams and aspirations, and that's one of the questions we ask. And I have seen that adolescents at 10 years who know exactly what they want to be are those that are going to go through school successfully.
Wow.
Those who come and they are faltering, they don't know what they do, you're asking them to at least give me something you want to do. They tend to struggle a bit. And so we'd like to encourage parents to be part of the conversation.
You brought that issue of parents, the difference between the two. Those who know what they want to be at 10 and they focus, and those who don't know. Could it be the environment at school, at home? We're talking about teachers who are giving the corporal punishments. At least have the corporal punishments at home.
At home.
Parents don't give audience for their adolescent, teenagers, to voice their issues and their concerns.
And for me, that is the misnomer that a lot of parents have. They think that when a child becomes 10 years, they've now become an adult. They're even given responsibilities of adults. Take care of the home because you're now an adult. They are not yet adults. They are still children. The constitution of this country says a child is up to the age of 18. And so parents are still responsible for these children. And one thing I want to let parents know is that adolescents want to be listened to. The moment your body language shows that you're not listening to them, they will switch off. They will switch off. And parents may misconstrue this to be being rude, being arrogant, and yet you have turned away this adolescent. Dear parents, listen to your adolescents.
Be friends.
Be friends.
With your sons and
Be
daughters
friends.
at that age.
Be the first doctor
Oh, yes.
or the first counselor.
This is very, very exciting information, empowering information, and I hope you will share it with your friends. Yeah, Dr. Sabrina, you've shared quite a lot. And since 2002, there's been a lot of improvement gradually.
Yes.
We are doing much better, even up to 2016, where the WHO passed that
The policy brief.
policy brief. So, any other things, call to action?
Well,
many people are watching tonight: politicians, policymakers, the public. Let's use this platform to, speak to them. Yeah.
Yes, and I just want to say that Uganda, we are trying, we are doing well, better than any other African country, I must say.
Wow.
Our Ministry of Health now has a division of adolescent health, which is amazing. There's an assistant commissioner.
Awesome.
There's an assistant commissioner in charge of adolescent health. And also we know that we've been pushing for, adolescent-friendly services, the adolescent-friendly corners, but maybe those are not going to be able to suffice to provide adolescent health.
Yeah.
My call to action is to every healthcare provider out there, please take time off and understand how to manage an adolescent. And if you forget everything I have said, there are two things that I ask of you.
Okay.
One is to be respectful and to have a non-judgmental attitude.
Wow.
And if you cannot manage this adolescent, refer them to the correct provider.
Wow.
We have so many adolescents in our country, and I truly appreciate that the Ministry of Education and Sports has changed the lower secondary curriculum to a skills-based curriculum.
Wow.
Because if we don't take advantage of our demographic dividend, if we do not harness the fact that we have so many adolescents, 1 out of every 3 individuals in Uganda is an adolescent.
Yeah.
If we don't support them to have skills, to be trained, to be the future leaders, then we have lost the opportunity to get into that middle income status that we are urging to become.
Yeah. To the doctors, the clinicians, the nurses out there, the surgeons, and every health professional. Let's respect the adolescents. Let's give them audience, just like we would give audience to an adult or a little baby. Let's not be judgmental. That's a big takeaway for me. Any parting shots as we come to a close, Dr. Sabrina?
Thank you very much, Dr. Joseph Gavin Nyanzi.
Yes.
First of all, you're very smart in your suit.
Oh, thank you.
And I really, really want to thank the Doctalk show for their continued effort to educate the nation in health. And to all the adolescents out there, big up to you. You are the future. Work hard, make a difference in the life of other people, but start with yourself. Self-inspiration is what really matters.
I'll again go back to Dr. Sabrina. Please remind us your book and where to find it. Probably you could share your number. Yes, your book, the title, yeah.
So my book is called The Real Pursuit of Excellence. It's available in Aristoc bookstore. But before I finish, Gavin, did you drink your milk today?
I'm going to take an evening cup of milk.
Okay,
because at 5. Yes.
Yeah, milk is so vital to all of us. It's just one chug of a nutritious meal.
Okay.
So.
Wow, milk like any milk. Cow? You mean cow's milk?
Yeah, cow's milk.
Okay.
Of course.
Okay. Wow, like fresh dairy, you mean?
Yeah, sure.
Okay. Wow, thanks for that reminder. Thank you so much. And we are going to leave it at this point. Please share this link and comment in the comment section below with questions, and we'll be glad to respond. Share this link with your family and friends. And let's not forget that every time you count 3 people, the third person is an adolescent. What does that mean? It means that about close to 15 million Ugandans are adolescents. That's a very big population. And if we choose to invest in them, health-wise and otherwise, we will be a very happy people 50 years down the road. We are saying bye for now. God bless you so much. Catch you next Thursday.
The Doctalk Show.
This weekend on UBC.
Arriving at the classroom with my cool